the first time, my name is Marianne. I'm the owner and the counsellor at Marianne Hanson Counselling Service. If you've watched me before, feel free to leave your comments, and also if you watch on the replay, leave your comments. Let me know what you think about this topic. So what I'm going to talk about today is short-term therapy versus long-term therapy. So there's no right or wrong with this. There's no rules around therapy and how long you're in therapy for. My personal view, based on the fact that I've worked in organisations such as Women's Aid and also as an EAP counsellor, where you could only have 6 to 8 sessions. So in Women's Aid you could have, I think it was 8 sessions. You could extend to a few more if like exceptional circumstances. Even when I was training as a counsellor, where I did my placement, you could only have 6 sessions. You could probably extend to 8. Then when I was on the EAP as a telephone counsellor, there was only 6 sessions. So to me, I've sort of worked in that way for quite a while. Even with my private practice, I offer time-limited sessions, but I have worked also long-term. There's some clients I've worked with on and off for about 5 years. Some clients I've worked with for 2 years, ongoing, it depends. So for me, I think I'm just going to talk you through some of the benefits and some of the advantages and disadvantages. It's just my personal view on this as a counsellor. Everyone has their own views, and also as a client you also have the choice. So one of the things that comes up a lot is the cost. Cost is a major factor. So if some organisations say that you have to have weekly therapy, they don't specify how long you can have that therapy for. If you're having weekly therapy, whether it's for an affordable rate at a cheaper organisation, or whether it is a subscription-based model like BetterHelp, or whether it is somewhere that charges, quite a high fee, you have to factor in the cost. And the point is, depending on the counsellor as well, you could have, it depends on what if the counsellor isn't setting goals with you or helping you to move towards your therapy goals or working with you in a particular way, say the approach they use is long-term as well, it means you're not going to get the results unless you work with them like over a long period of time, which means it is going to cost you more money. So the advantage of short-term therapy is that everyone knows they've only got 6 to 8 sessions, or sometimes it can be a bit longer. Short term can mean 6 months, it can be up to, in some cases, but in time limited therapy, especially in brief therapy, it's usually 6 to 8 weeks. Both parties know that they've got a certain specific amount of time to work, and I've always done my best work. I'm not saying that I can't work well long term. There are some advantages to that, which I'll talk about in a minute, but there's just a different energy that goes into it. When I know I've got 6 sessions and it's time limited and that's it, you just work in a different way. The counsellor and the client works in a different way because they know they don't want to waste any of the sessions. They know that there's not time to kind of go into depth, but at the same time you go into enough depth so that you get to the point of what the client is in counselling for. Everyone's different. Short term definitely does not work for everyone, but the next part that I want to talk about, because the costs is a major thing in this day and age, because you've got waiting lists where people are on the waiting list for like up to a year. I know people who've been on waiting lists for, even for you used to be able to go to your GP and you'd need counselling, and they'd refer you and you'd probably get seen within 6 months. That was reasonable. Even 3 months, I knew people that would get seen in 3 months. That was seen as normal. Now if you go to your GP, people are having to be put on a waiting list. I know people who've come to, hi Jackson, people who've come to see me as a private counsellor whilst they're waiting for their long-term therapy from their doctor's referral, because the doctor has told them it could be 12 months. Now, someone's not going to wait a year to deal with an issue that's affecting them in the day to day. It's too long. Thanks for all the comments and the love as well. So let's look at relationship building. So if we're looking at short term versus long term, there is definitely an advantage to working with your counsellor long term. The clients that I have that have been coming back to me on and off since 2020, I've had people in COVID that I was seeing, and they still come and see me now, but they haven't been seeing me for 5 years consecutively. it's been on and off. But I've also got clients who I worked with for 2 years straight. You do build a relationship, but one of the disadvantages as well is that you can become complacent, because it can then become a bit, not even friendly, because the friendly part is still part of being a therapist. You've got to build rapport. You know, you're not judgmental. You want your clients to feel comfortable. But I do think this is one of the reasons I sometimes advocate more for short-term therapy. And when I say short-term, even if it's 2 months, 2 to 6 months, because you get to a point in therapy, everyone does, where it plateaus, where you've talked about the issue enough, you've used enough interventions, where you've gone as far as you can on your counselling goal, and then where it just becomes people are booking in the therapy, and then it's just not going anywhere. I'm not saying that in a bad way, because there are situations with I personally believe long-term therapy, you need that for post-traumatic stress disorder, anything which is like disordered, whether it's disordered eating, addictions, I'd say relationship issues. For the most part, they can be done short term, because I do that short term as well, but longer term, if there's multiple things, multiple issues as well, trauma, childhood abuse, domestic violence. But even, as I've said, Women's Aid, they only do 6 sessions or 8 sessions, and I did some good work with them in 8 sessions. I think society, but also clients, sometimes feel that they have to have long-term therapy for it to be productive and also to get the outcome. But I know for a fact that you can do short-term therapy and still get good outcomes and good results. Gorilla fan, thanks for joining. So the relationship, the counsellor does have to work harder then to build that relationship, when they know they're only going to see this client for like 6 sessions, maybe 8 sessions, maybe a few months. But then, as I've said, the disadvantage could be that you can become too complacent. If you've been seeing the same therapist for 2 years or for a year, it can become a bit too familiar, and that's where the boundaries have to be put in, and that's where you have to continuously review the goals. You have to continuously say, do you want to focus on something else? Are we going in the right direction? So there are ways of doing that, but I just think my experience has been that I start to get like too familiar with that client to a certain point. Say like it's been over a year or it's been 2 years and they're still, we're working on certain things. As I said, let's exclude things like trauma, which, trauma therapy, it is long term. Let's take things out of it like addiction. That also can be done in short term as well, but if someone has like OCD or some sort, but I don't specialise in those areas. To me are really specialised as well. Relationship issues, I think it depends. It can be like done in 6 sessions or 8 sessions, but if there's been multiple things that are impacting on the relationship, then yeah, longer term. Or if there's a long-standing issue, that means an issue that has been with the client for many years. Even depression is another one that, depression and bereavement, until I worked as an EAP counsellor for an employee assistance program, I would not have thought that those types of issues could be, worked with on a short-term basis. So until I did solution-focused therapy, which is 6 sessions, I would have thought, you can't talk about bereavement. You can in 6 sessions. You can't talk about depression in 6 sessions. But you can. I suppose there's quite a lot of things you can do. It depends on the skills of the counsellor. It depends on the client. It depends on the method you use. And solution-focused is very clear. It's not looking at the problem. It's looking at the solution. So if you're going in there from the beginning with, okay, what are the options in terms of this problem that the person has? What are the different ways angles we can come at this from? Then you can do that in 3 sessions. You can do that definitely in 6. So the next thing to think about is like solution-focused or a short-term therapy gives someone a chance to test if it's working. The one thing with long-term therapy that sometimes can be an issue is that the client is reliant on coming to therapy every week, which is a good experience, and there's nothing wrong with that. But because they sometimes get used to being in therapy, it doesn't, outside of therapy, it means they don't get a chance to test all the things that they've been talking about in therapy. Because unless therapy, there's two ways that therapy works, and that is one, it's what you're doing between the therapy sessions, because the 50 minutes a week is not enough to actually resolve like the issues. It's like a springboard. So what you're doing between the sessions is important, but also when therapy ends. When therapy ends, that's really when you know whether it's worked or not. Because whilst you're in therapy, you know that it's probably, you feel that it's working because you're talking to your therapist, you're saying, oh, I'm much better at this now, much better at that. But when therapy ends and you then go off and you're in a situation that, causes you to feel stressed, or something major happens in your life, that's when you know, oh, I remember what my therapist told me. I remember this method that we used in therapy, and then you put it to the test. Now, you can only really do that when you step away from therapy and when it ends, and then you put that in place. If people are in long-term therapy sometimes, it's, and I've experienced this, but also because I supervise counsellors, they've experienced it as well sometimes. The client will be coming to therapy every week, and they'll be using therapy as the, the space to explore the issue, but then they won't be doing anything in between, and they'll come back and it will be the same thing the next week. And there's nothing wrong with talking about an issue consistently for weeks and weeks and months, but if you're not doing anything in between, or you're not putting those strategies in place, then it's unlikely that there is going to be that change. But I'm not saying there won't be the change, because to be fair, if you're a person-centred counsellor, and if you believe in the whole idea of person-centred therapy, which I do as well, it means that eventually talking about something will give you'll come to some conclusion about what you want to do. But the point is, if you, with brief solution focused or with short-term therapy, having 6 sessions and then it ending means that you then go away and you need to use what you've learned in those 6 sessions, and you need to put that into practice. And then it doesn't mean you can't then come back for a further 6 sessions, or you can't go back to long-term therapy, but it just means you've had enough information given to you so that you can put it in place. The other thing is, it's about the focusing on therapy goals. I said that sort of a little bit in the beginning. If you work in a short-term way, the focus and the intensity on the goal, it's similar to single session therapy, because that's another thing. I never did single session therapy until I worked for an organisation, which I did some training with them on single session therapy. Now, Windy Dryden, that's his name, Windy, he's an American guy, I think. He might not be American, I don't know. He has written a book on single session therapy, and he believes that with specific issues, you can have one session, just one, because it's called single session, and you can get miracles can happen. I don't know if that's personally true, that one session can do that. I have had top-up sessions with clients where they've seen me before and then they've come back for a top-up. I have done single session therapy in the EAP organisation I worked for. It was effective to a certain degree. I don't know if it was enough for the client to then say, yeah, my issue is now resolved because I've had one session, but it definitely gave them the springboard to look at things differently. It definitely gave them that 50 minutes to explore other options. So I think the focus is more on the therapy goal and why the person's in counselling, when you know you've only got 6 to 8 sessions to work with, because you don't have time to lose. You need to use every one of those 6 sessions effectively. So when I was at Women's Aid, and you know that if you're working with someone who's had a history of domestic abuse, where there's been so much things they need to sort out practically, physically, emotionally, all sorts, you're not going to be able to go through all of that in 6 sessions. It's impossible. So what you do is you might focus on one thing, one aspect, And what's good about that is that the client then can zoom in a bit more on what it is exactly that they want. So, okay, we've got 6 weeks. We're not going to be able to look at how your self-esteem has been damaged through domestic violence. We're not going to be able to look at all the past domestic violence incidents that have happened. We're not, but what can we look at? Okay, we can look at you going forward as a person, what you need to heal right now, what is important to you. We can look at self-care. We can look at, you know, the journey that you've been on to a certain degree and how that is impacting on who you are now. We can do some empowering stuff. We can look at some of the, you know, damage and some of the things that have happened to you which have caused you to feel the way you do about yourself. I mean, there's loads you can still look at. People think 6 sessions, 8 sessions. It is to do with how you work. Hi, Adam. Thanks for joining. It is literally to do with how you work as a counsellor and how you make use of that time. So my feeling really is that moving forward, there will be more of these organisations that say 6 to 8 sessions is the way forward. Partly it's because they want to see more clients. If you've got a waiting list of that's a year long, year and a half, you want to be able to see as many clients as you can. One way of doing that is to not have like long-term therapy. But the other point to it though, for some organisations, they only want to do long-term, and that's obviously to do with cost. It's to do with being fair to their clients. They feel that if they limit it to 6 sessions, they're not going to get the range of clients, because clients with a lot of trauma or clients who need to work on specific issues are not going to be able to do that sometimes in 6 to 8 sessions. But I just think if you're someone who is saying, I can't go to therapy because it's going to take me too many months or too many years, or the cost of it and that sort of thing, maybe check it out. Just think to yourself, maybe I will have time limited therapy. Maybe I'll say to my counsellor, can I work with you for 6 weeks and then see how it goes? Or you might go in there specifically to a counsellor who only does 6 to 8 weeks. In my private practice, I've done like a combination. So I'll do, if you go to my Facebook page, you'd see that I've got information about time-limited therapy. I've got some sort of flyer, 6 sessions, and that's what I can, with specific issues. And I've done that a few times. Anger management comes up a lot. So I've worked with people with their anger management, 6 sessions. Low self-esteem, 6 sessions we've done. What else? I'd say there's not like, because as I'm trying to say, like if someone comes to me and I do an initial assessment with them, it's about their needs. It's not about like what I'm promoting and saying that this is what I want you to work with me for 6 sessions. It's more of if this client's presenting issues, if we talk to each other and we decide, okay, do you want time limited therapy, which is tailor-made to you for 6 sessions, then we can do that. But if you're saying you feel you need longer, you need long-term, then we can do that as well. So it's just giving people an idea really of what are some of the advantages, what are some of the disadvantages, what are some of the ideas around short-term, long-term. It's something that comes up a lot with counsellors. There are lots of discussions around it, you know, but ultimately it's down to you. It's down to you as a client, what you feel you need, what you feel you want, and what works best for you. So thank you, Jake. You got Jackson, Gorillas fan, and Adam. Thank you for joining me, and everyone else that joined on this live stream and has left any comments. Thank you, appreciate it. And I'll be back next week. This was a shorter live stream today because I just wanted to sort of touch on this topic. Hi, I can't see who the name is. Isian, I think it is. Sorry if I've pronounced your name wrong. Thanks for joining, and anyone watching on the replay, feel free to leave your comments, and you can share this with others if you feel they'll want to watch it too. Have a great week. Bye.